I think having had cancer, and I was diagnosed with aggressive prostate cancer 6 months after my father had died from complications of the same type of cancer. I think having gone through that experience, I often tell patients, I said, it doesn't matter what degree of cancer you have. When you hear that word, your whole life is thrown up in the air, and what comes down is the same picture, but the puzzle pieces don't fit together anymore. Nothing is the same. You're not the same. You're changed from your core out. And you have to learn to live with that. You have to learn to embrace it. You have to learn to move through the process of who you are. And it opens up a lot of questions and a lot of actual joy in understanding that, yeah, I do have a disease. It may come back at any time, but the joy is that every day is a new opportunity. My name is Lynn Larson, and I'm a nurse practitioner at Utah Hematology Oncology. I started at Utah Hematology Oncology for a very specific reason. I knew one of the practitioners, and I had been diagnosed with cancer, and an opportunity came along. And I think at this point, looking back on it, it was to bring certain gifts that I've been blessed with to patients who have cancer. A better understanding or a sympathetic ear of knowing what they were going through. My approach to patient care is kind of unique. It was formulated when I was in nursing school. I had a nursing instructor who believed in a very holistic approach, emotional and spiritual and physical. And I learned through the years in working in various places that that is very important. The most rewarding part of my job is the hardest part of my job. I think the most rewarding part of my job is when you have to comfort somebody. The most rewarding part of my job is when you have to comfort somebody. When the pain is too great for them to bear, and you can help them. You can help them through that journey.